Welcome, everyone, to Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Tonight, I'm going to be focusing on what I feel and what other experts have said will be our future, at least in the foreseeable months, which would be rolling outbreaks. Basically, we're going to be seeing as governments start opening up, as soon as a day or two from now, some places never really closed down, like the state of North Dakota. But in the coming days, we're going to have more and more people opening up their businesses with a lot of trepidation, I'm sure, trying to figure out the best way, the safest way to do business, and also to care for their customers and their employees so that the most minimal get sick and or die. And I see, especially locally, an earnest effort to do that. But I am still worried because so much of what we see, especially on social media locally, tells us we're just not doing it right. So many of the posts and the pictures that I see show people that are still not wearing masks incorrectly, and not social distancing enough or in the proper conditions. For example, when you're in close quarters for extended periods of time. And the reaction to information coming from other countries where the outbreak has already been, such as China. Granted, we don't necessarily trust all the information coming out of China, but we can't throw the baby out with the bathwater either. There is credible evidence that the virus travels through the air in an aerosolized form, can hang in the air for up to hours at a time, and can even be recirculated by the air conditioning system or the heating system. If all of those things are true, then this reopening of our government, of our states, of our businesses is going to have us, basically experimenting with the customer base, the employment base, to see which ones of those things that we've heard from other countries about what could happen and how outbreaks could happen again are true and which ones are not true. I guess we're all going to be finding out very, very soon, including the breaking news today that the meatpacking plant here in Minnesota has been impacted. In fact, Governor Walz and Congressman Colin Peterson, met with the people of the meatpacking plant in Minnesota to talk about how they're going to go forward to reopen the plant, test people adequately and make sure that the workers feel safe in returning home in accordance to the new order from our president that meatpacking plants are now supposed to stay open under the protection, what's it called? The head shape?
Something protection,
Something
act.
Protection Act.
Yeah.
I told you guys about it yesterday. I can't remember what it's called today. I'll tell you what it is. I showed you this Politico article in which the Defense Protection Act is being used to keep the meatpacking industry open. So this is going to have a profound impact as companies across different states, across different counties, with different numbers of people working inside of them, decide how do you social distance appropriately inside the plant. In my cursory review of the CDC guidelines, what you would assume is that there has to be a decrease in production. There has to be a decrease in production in these plants because you have to have a certain amount of space between people in order to social distance. And in most meatpacking plants that I've ever heard of, people are shoulder to shoulder with no social distancing. They would also have added personal protection equipment in addition to the social distancing rules. All of this implies a reduction in production. And what I can tell you about that, what we have seen so far as the pattern of how you do business, is that most of these companies have resisted testing even in order to not have to slow down their production. The backlog of animals needing to go to slaughter immediately cannot withstand even a reduction in production. It needs to have these meatpacking plants open again at full capacity in order to clear up the bottleneck so that the farmers, the people that are creating all of this meat, don't have to euthanize their cows, their chickens, their pigs, throw away their eggs, their milk. There needs to be distribution that is open and clear, and it requires it to run. These animals, these farmers, they can't even afford to keep the animals alive for a longer period of time because if they weigh too much, if they gain too much weight and they have too much fat, they're not fit for the slaughterhouse anymore. So they have to kill them anyway. So everything in the production chain, especially with regard to the growth of the animal, is very metered, is very calculated. And if something is off, like all of the meat packing plants, in order to keep their workers safe, have reduced to a half production or have gone down to a reduced production in order to keep people safe, is that going to be sufficient to keep the farmers, the producers, from having a very bad impact that would pull them into bankruptcy? Has the government made some kind of provision to subsidize farmers? I would like to see that. I would like to hear about that because I don't think that we are out of the woods just because the president slaps the Defense Production Act onto meatpacking industries or distributors. I don't think that solves our problem until we get down to the heart of how we conduct business safely, which I think implies production reduction. I don't know. I guess we're going to discuss it today, and we're going to talk about the possibility of outbreaks in all of these different sectors of business on a Mexican crossing lines. But first, I want to thank you for all of the comments. I appreciate the people's comments and criticisms, and of course, all of your support for our station, for independent media. Folks, how can you get connected to us?
Oh, you can connect many ways. One is give us a call on our message line at 701-566-0917. Again, that number is 701-566-0917. You can email Cindy at kpppfm.com or me, Duke, at kpppfm.com. And at Facebook. Facebook's been one of the places that people do the most messages. These lives are one way too. People do a lot of comments. We're streaming on Facebook at our 88.1 FM Fargo Moorhead, and we're streaming online on YouTube at Duke 1517. We also have a website, kpppfm.com. You can go there and look at our past stories, our past shows, and you can actually comment there too. And there's a web form that you can send it to get a hold of us. And so there's you can tweet us at media_PPP. And when you're at kpppfm.com, go to the donation tab and make a donation to our organization. It's a tax deductible donation for a nonprofit so we can continue to do this work. And we're going to continue to do this work. And we appreciate all the support you give us and watching and sharing. Share. It's going to be a great show.
So, folks, let us start with the numbers because they keep going up.
Yep.
We're not seeing a reduction in numbers. One of the things that was said about how we go back to work safely is that we have to have a reduction in our numbers for a period of time.
Mm-hmm.
We are currently, for the worldwide numbers, at 3,179,494. That's where we're at right now. Total deaths, 226,173. In the world, we are over 250,000 deaths. We know that the numbers that we are getting out of different countries, especially places like China, have been underreported. We also know that reporting of COVID deaths is questioned by a lot of people because of the way that it has kind of overtaken different countries. I wanted to show you in terms of some of the countries that are now being brought up here in the United States recently. Governor DeSantis of Florida met with President Trump, and they talked about Brazil now being one of the countries that has a huge outbreak of this virus. And as you can see from these countries, I did a much closer look at the United States. So you can see, most of the U.S. here. And right where we are in North Dakota, in Minnesota, in Montana, there's not a lot of red.
No.
The little red dots, they're there, but they're spread out with outbreaks being closer to Denver, Colorado, and, places like Minneapolis and Chicago, St. Louis, Kansas City, etc. But if you pull out, you will see this virus is continuing to spread. Yes, it had its nexus. It had its, hot spots all the way over on the East Coast, right? Big swaths of it dotting the entire country. Not so much in the Midwest, in Wyoming, South Dakota, North Dakota, Nebraska, Minnesota, Montana, Idaho. It doesn't mean it isn't continuing to spread. And in the countries like the ones that you see here, we still have our numbers rising. Brazil is up to 74,000. Following behind that is Canada with 52,000. Belgium is almost at 50,000. The Netherlands is getting up into the 40,000 range. India is also rising. Peru is at 31,000. Switzerland is at 29,000. Portugal is at 24,000. Ecuador, where we've seen some of the most horrid images of bodies burning in the street, people just dropped in the street, 24,258 people. So our numbers, they continue to rise, even as here in our country, we are discussing opening everything up. Long before we have all of the different safeguards in place that would, give us a layer of protection so that we can track and trace, so we can test adequately, so that we can keep our workers safe as they try to recover and as the economy tries to recover. Let's take a look at where we are in our country right now. Currently, We are over 1,063 cases, 61,618 deaths, 147,000 recovered. If you take a look at the states, looks like we've bounced back from the gaps. There are gaps in reporting here in terms of the new number of new cases and number of new deaths. But for the most part, it looks like a lot of it has been filled in since our check-in yesterday. We have 330 new cases of death in New York, 4,708 new cases. Their numbers of deaths in New York seem to be slowing down and getting lower and lower. Remember when they were up into the 700 range?
Oh, yeah.
So they've managed to flatten that curve and keep it flat. Hopefully, reopening new areas will not jeopardize that. We'll keep a close eye on it for you. New Jersey, up 328 new deaths. Massachusetts, up 252 new deaths. Illinois, up 90. California, up 77. Pennsylvania, up 294 new deaths. Michigan, 103 new deaths. I know that people out there, especially those who are cheering for our economy to return, those who are trying to be pragmatic about how you balance the suffering of the economy with the suffering of the loss of life. People like Ben Shapiro will tell you that the bean counters out there, the actuaries out there calculating the loss of life are saying, for the amount of life that we lose to all of the other things that kill people, this isn't so bad. It's not that bad. But when I see that we are losing hundreds of people in states like Pennsylvania, New York, New Jersey, Ohio, Massachusetts, Pennsylvania, dare I say Pennsylvania? I don't find that acceptable. I don't think that and that's just the number of deaths that are reported for that day. That doesn't take into account people that have been sitting on a ventilator for a week or longer, all of whom might pass at the same time or near the same time. So it just depends on how you feel about the loss of life versus the loss of business. I will always be one of those people that's going to err on the side of choosing life. Tell us how we're doing in Minnesota and North Dakota.
Well,
are our numbers continuing to rise?
Yes, we had over 443 new cases in Minnesota in one day.
Wow.
And so the confirmed cases are 3,816. There are 1,842 recovered. There are 286 deaths. In our county, Clay County, we're up to 149 cases with the 10 deaths. That's not good, folks. It's rising. And same thing in North Dakota. North Dakota had basically, let's see how many new ones. It was like 40. And 42 tested positive from yesterday. And there's no new deaths, but there's over 1,033 total positives in North Dakota. And there's still 82 in the hospital. There's only 437 recovered out of that 1,000. So it's less than half are still sick. And again, most of it is Cass County. Cass County attributes, the county is here, the county we live in. It attributes to over almost half the cases in North Dakota. And, that's...
Do you think it's because North Dakota never sheltered in place?
Yeah, and it's because people in Fargo have been dumb. You really have been. And you're just going to be dumber.
That's not the North Dakota motto. It's North Dakota smart.
North Dakota smart is their motto, and it's North Dakota dumb. They're opening the bars. The problem is that they partied all the way till they had to close the bars. And then all these cases started happening. People haven't been sheltering in place because they haven't had to. People are going to the stores. People are out and about. People aren't wearing masks. They're doing all these things.
Some people are, but a lot of people aren't. So I think it defeats the purpose.
Well, the thing is with Governor Burgum does this measurement where if you take the amount of people who have died, the amount of people who are positive, and put it towards the whole population of the state, or the number that are tested, you come up with this really small number. And to me, I'm like, it's not a small number if it's your brother, if it's your father, if it's your mother that gets sick.
Yeah.
And also there's implications of when you get sick, some people get things that happen to their lungs for the rest of their life. This is a preventable disease.
Mm-hmm.
It's a preventable death. And we're acting like we've got to get people out to the bars again. We've got to get whatever needs to open in North Dakota because all the people are hurting. They haven't even figured out the unemployment thing to help people at home. So they put them back to work and they don't even need to worry about employment anymore. They've been bumbling things up. And it just makes me angry because it's reckless. And it's in a day, and tomorrow's another day. And they just tested over 1,000 people on Sunday, and it takes 72 hours for the test. I think that's going to hit Thursday or Friday, and we'll see numbers in Fargo jump again right when they open up the businesses.
I want to give people as wide of berth as possible, knowing that we're all going through this trauma together, as well as businesses the benefit of the doubt. I don't think there are any businesses out there that are seeking to recklessly go back to business as usual and put the health and the lives of their patrons at risk, or their employees for that matter. I really don't. I don't believe that is true of any of our local businesses. I do believe that when the profits of places that are part of this multi-billion-dollar beef industry, or meat packing industry across the country that feeds the world, not just America, it feeds the world, is disrupted, and you have losses because you're not running at full capacity or you're shut down, period. That's where I think that's where the recklessness can come in. I think that's where CEOs, where managers are starting to go, well, do we tell everyone that we suspect there are some cases of COVID when we don't have enough testing capacity in our town, in our county, to send everyone in our facility to go get tested? Where if we follow what everyone else is doing in town and wait until we have a positive case that we can actually report, and then implement the CDC guidelines after that happens, so we don't have to stop production and retool everything and put up spit guards and all of and create all these other things, which are going to cost us money and time.
Mm-hmm.
Then, we won't be any more worse of a bad guy for letting people die or get sick than any other person following the same business practices, because it is an unspoken thing, but people are going to just kind of follow the same pattern that is signaled by the leadership, which includes our governor. I'm going to read some comments real quick. Mary Fairchild. Hi, Betty. Betty is always visiting from the Arizona Rim. How's Arizona doing? I'm always paying attention to what's happening in your state, Betty. Mary Fairchild says she's very curious to see how the Disney reopening at half capacity will affect the whole country. So am I, because people obviously come from around the country to this one destination. And I want to thank and give a shout out to Charlene Dupuy for supporting local independent media. Thank you very much. Every single one of your donations to support our station keeps us going. R. Scott Page comments, where do we draw the line? There are more people out of work and losing business compared to those that have died. It sucks that people have died, but we need to move forward as Americans. This is true. And you know what I think really would give Americans hope? What the president has and the task force have told us we need to be looking for, which is ramping up the capacity of testing. Many states are doing a great job at that. I think North Dakota is doing a great job. I don't know where you're living, Mr. R. Scott Page, but hopefully your governor is working to ramp up that capacity, because being able to test people, antibody testing, combined with the fast tests, so we know who's currently sick and we can isolate, quarantine those people, keep them from the rest of the population so they don't infect others, and find out who already has antibodies, and how we can use plasma testing to care for the sickest people. That's going to be a major deal breaker. That's going to be one of the things that's going to really help us flatten this curve and give people a sense of safety that they can come back out of their houses, that they can go back to their jobs. Otherwise, we can pay lip service. We can bully people. We can lie to them. We can pressure them. And it's not going to make people go out and risk their lives because our distribution supply chain is falling apart, or because the restaurant industry is falling apart, or because the artist industry is falling apart. I've been watching those things happen, and I know there's a lot of creative Americans that have been seeing the same thing and going, how can we raise money for those folks? How can we support those businesses? How can we keep the economy alive? The real answer, the complete 100% honest truth is, we don't fix it until we reestablish trust. The only way Americans are going to feel safe putting themselves on the line, people that are 50 years old or older, or that have comorbidities, that have underlying conditions that have put them at higher risk for death if they catch this thing, they're just going to vote with their wallet. They're going to vote to stay home. They're going to vote to live another day to see their grandkids grow. They're going to keep on staying home and protecting themselves unless and until we give them hope. Unless and until we give them hope. We can give them the statistics about what's happening. We can even share what doctors are saying. Look what happened, folks. Let me just bring it back to you. Look what happened after Dr. Oz, Dr. Phil, and all the three, the triad of doctors, the triad of TV doctors. What's the other one from MTV? The MTV doctor.
I remember his name.
Drew Pinsky. Ah, yes, Drew Pinsky, Dr. Oz, Dr. Pinsky, Dr. Phil. They all came on to try to reassure you. Hey, I got a doctor in front of my name. That must mean I know things. And they're going to tell you, hey, you know what? More people die of swimming pool accidents. That we should be taking these up, different things and doing it. Jerry Lee Nochi says Bakersfield, California, Kern County here, 688 confirmed, 6 deaths. County population, 888,988. And Jerry Lee, a set of doctors, I believe from Kern County, were some of these doctors, this time emergency room doctors, that took to the media that were shared, that were sent to yours truly, saying, hey, we're looking at the science. We're looking at the testing from the clinics and the hospitals where we work. Me, Dr. Daniel Erickson, and Dr. Anton Masihi, we're doctors. We're emergency room doctors. This is what we have to say. We were listening to, I wanted you to hear some of it because we were going to be discussing it. I wanted you to give me your take on some of the things you said. I didn't even have to ask you. As I was having it playing in the background, you were like, what is this?
Shut that thing off. No, because it comes down to that attitude. I understand is like we need money to live. We live in a capitalistic society, and I'm behind on our mortgage. I'm not having money coming in. Unemployment's not paying anybody. And so I understand that, but at the risk of people dying in my immediate family, none of this stuff is worth it. So Case Tractor can build tractors over in Fargo. It's like I have to take these risks and have people in my community get sick and potentially die because Case Tractor needs to build some tractors. I mean, I see the food distribution thing is like we've went the wrong way to helping people in this community. And these doctors are talking like, well, it's expendable, just like Bergam. The people in North Dakota, there'll be some that die, but big deal. It's not a big deal. It's a lot less. People die all the time. They die in swimming pool accidents, But we haven't had swimming pool accidents overwhelm emergency rooms in New York before.
And we haven't had a case where if I go swimming, it kills my neighbor.
Yeah, exactly.
I mean, it's quite a bit different. But here's the thing, and I think I must have misread that number, Jerry Lee. It's 866 confirmed. Let me just say this, though. I listened to what they were saying. I think that they're fine doctors. I think that they're looking at the statistics in their community. I think that they are making statements based on what they're seeing, and also based as how they put it from an entrepreneurial point of view, not a medical one, although there are physicians, but they were saying from an entrepreneurial. So looking as physicians, looking at the best practices for business. That's uncalled for. First of all, if you're speaking with your scrubs on as a doctor, I want your medical opinion. I don't want your opinion from as the Better Business Bureau. I don't want the Chamber of Commerce. You can have a doctor on the Chamber of Commerce, but if he's sitting there talking on behalf of science and medicine, then he needs to be focused on outcomes, on science, and on medicine. And let me just tell you, the American College of Emergency Physicians put out a statement about these two gentlemen, which I'm going to read for you now. Because if we're going to trade in reality, if we're going to address what they said, we have to hear from their colleagues, from the American College of Emergency Physicians and from the American Academy of Emergency Medicine. This is what they had to say, and it's titled A Joint Statement on Physician Misinformation. It can come from anyone. It doesn't have to be Hollywood doctors like Phil. It could be ER doctors like these two that decided that they wanted a moment in the spotlight to bring business back instead of to focus on science. And this is why they're being called out. These reckless and untested musings do not speak for medical societies and are not consistent with current science and epidemiology regarding COVID-19. Right out of the gate, sounds harsh.
Wow.
As owners of local urgent care clinics, it appears these two individuals are releasing biased, non-peer-reviewed data to advance their personal financial interests without regard to the public's health. COVID-19 misinformation is widespread and dangerous. Members of ACEP, the American College of Emergency Physicians, and AM, American Academy of Emergency Medicine, are firsthand witnesses to the human toll that COVID is taking on our communities. ACEP and AM strongly advise against using any statements of Dr. Erickson and Dr. Masihi as a basis for policy or decision making. The two agencies just discussed, the American College of Emergency Physicians and the American Academy of Emergency Medicine, jointly and emphatically condemn the recent opinions released by Dr. Daniel Erickson and Dr. Anton Masihi. COVID-19 misinformation is widespread and dangerous. Don't forget it. We're constantly bringing that to the fore and exposing it when we find it. And I know that makes people sad because, especially if you had placed some hope in that these different people telling you can get rid of COVID by gargling water or eating elderberries, or in this case, by just ignoring what people like Dr. Fauci and your president is telling you, then you're going to be able to go on about your life without feeling the guilt that you have put people at risk. But the reality is, when there is false or misleading information, it needs to be exposed, as well as whenever there is hopeful, new information actually based on science that can give people, especially those that are making policy and making decisions for our country, some hope. We're going to bring you that information as well. Now, let me just tell you a little bit about why what they said was so wrong. Just some details. While ACEP believes strongly that practicing emergency physicians do have valuable insight into the COVID pandemic, specialists in immunology, infectious disease, and epidemiology, including Dr. Anthony Fauci of the Presidential Task Force, are the most qualified at interpreting this data and making representations. The cited data by Drs. Erickson and Masihi is extrapolated from a small population to the state of California, resulting in misleading conclusions regarding mortality of COVID-19. Their data is flawed and it represents selection bias. In order for the data to be extrapolated to a population, the investigator must be assured that the population is homogeneous, and in this case, they are not. For example, it is stated in the video that in one area of California, there's a 12% positive test rate that is then erroneously used to conclude that there are almost 4.7 million cases in the entire state of California. But that framing only looks at the 12% of people who had access to tests. California is a large, diverse state, and it is unlikely that any one area will be representative of the state at large. As testing nationally is limited, there likely is a larger pool of people who have yet to receive a test but have a high probability of having the disease or who are asymptomatic and probably contagious. What we do know is that the number of cases in most states is growing. The same extrapolation was used in his New York example when, again, the only people tested were those who were asymptomatic. Because of the limited availability of tests and the as yet unknown sensitivity and specificity of the various tests, we cannot use this data to extrapolate to larger populations. And this goes on. I will share the full statement where they go through a lot of the statements made by doctors Erickson and Masihi, and they tell you why they're wrong. And I want to give you some hope today, so I will be bringing you some new medical updates. But these statements from associations, from doctors, and this one I'm going to bring you from auditors, shows you how even the official information that you are getting from your state may be skewed. This information was sent to me by my dear Papa back in Iowa. Hola, papi. Gracias por la información. Who's watching as information is becoming more and more difficult to obtain in the state of Iowa, where I was raised and where I grew up, and asking the state auditor to give more depth to why we are getting skewed numbers. Take a listen and then ask yourself, is my state auditor finding out this information and making records available from different businesses like nursing homes that want to use HIPAA, that want to use things like HIPAA to say, I don't have to tell you how many people have coronavirus at this business because HIPAA. Ask yourself, I'm asking, I want to know if our state auditor is doing that for Minnesota and North Dakota now. Take a listen. State Auditor Sand of Iowa.
We also did an advisory on the disclosure of health-related information to the public. And the reason for that is that we had seen some public entities in Iowa saying they could not share information about how many people were infected at particular businesses or that particular businesses had an infection because of HIPAA. That's the reason that they provided that they couldn't share that information with you. It's not correct. Our office has an obligation to help promote compliance with laws, generally speaking, and one of the entities that incorrectly stated that HIPAA kept them from providing that information is an entity that we audit every year. So when we see something that's going on and we know that there's a risk that it's going to be continuing and we have an obligation to handle legal compliance questions, we think it's in a better practice to issue an advisory to try to actually get out in front of it. And as they say, an ounce of prevention is worth a pound of cure. So we put together an advisory this week after sorting through it, clarifying for members of the public, but also for public entities that HIPAA doesn't actually stop you from doing that. HIPAA makes sure that you can't share information that can be traced to an individual. That would violate their privacy. But that actually there's a piece of Iowa law that's the only law that would stop them from sharing that information with the public. We think it's important for people to know where there are outbreaks and how many cases there might be in particular locations. In fact, so does the Test Iowa assessment that everyone has been promoting. The Test Iowa assessment asks you, have you been in contact or been close, something like that, to anyone else that has had a positive diagnosis within the last 2 weeks? So you are going to want to know what businesses in your area have had outbreaks so that you can answer that question accurately. It's really hard to answer that question accurately if you're not told where there are outbreaks. You look at most small towns in Iowa, you're going to have, and actually this is, slightly bigger towns, not the really small ones. But if you've got 2 grocery stores and there's one that you go to and one you tend not to, you're really going to want to know which grocery store had that outbreak because that helps you assess your own vulnerability. It helps you answer that question accurately on testiowa.com, stuff like that. So we issued an advisory to make sure that was clear.
Okay. So I want to stop here. As businesses are reopening, we have businesses reopening. Some businesses are going to say, okay, you know what? We're going to make everyone wear masks. Costco is reopening now at a lot of their locations. They're demanding if you try to come in, you're not wearing masks, you can't come in the store. Costco, I love you. Why? Because Costco is setting the standard. Costco is saying, you can't shop here. You know what? It's going to make all of the people that are scared more comfortable about shopping, knowing that Costco is making sure that there's places where, there's arrows, there's distancing. Their enforcement of the mask thing, businesses enforcing the distancing, businesses enforcing making sure you walk in, you put on hand sanitizer before you go in the building. And more importantly than all of that, businesses being transparent about outbreaks. Businesses saying, hey, I just had somebody test positive. I'm going to have all the other people in my facility go and get tested so we can tell you how many of us are positive for COVID. I'm going to decide whether or not I shut down my business altogether or have somebody else run it until we can get this under control. But I'm going to announce it to the public so that you, as a person out there, can make the decision whether or not you want to go to that location and put yourself at risk. As long as we're not telling people where the outbreaks are, and folks, believe me when I tell you, I am a champion of local businesses. My husband and I run one. My family, my brothers in this community, they also run businesses. We want to stay alive, but we want to make sure that we tell folks the truth, that we don't put other people at risk. Here's the thing. If there were businesses, especially these large ones where we saw outbreaks in the past, that refused to get tested for their businesses because they didn't want to be shut down, because they didn't want to be told that they have to go down in capacity and productivity or that they have to shut down. If those businesses are willing to lie, do you think that now that we've reopened, those are the same kinds of businesses, that other businesses like them, that businesses in general would somehow start to get worried if they have a case and start lying and saying, well, we won't report it until next week. We won't report it until we get a second test done or we get confirmation that a test was done, knowing we don't have enough tests? Or are you going to be the kind of business that when you have somebody that has the symptoms for coronavirus with or without a test are going to tell the public? That transparency is going to depend on the individuals and their businesses. And I don't know. What do you think, Duke? Do you think people are going to be compliant and honest? In Iowa, as you can see, the auditor has had to step in and say, no business XYZ.
Well,
you can't keep that secret.
I've already seen Eventide play that game and not want to report it. I've covered that in some of our casts, and their numbers are up to over 20 now. And they basically didn't want their first one to be even noticed on the map. Right. So, it's a hard thing if people, they have to report for the safety of the community. The businesses aren't used to doing that. people get their hands cut off and arms chopped off, and they get killed in businesses all the time. And there's a workers' comp system that takes care of that. There's insurances that take care of that. They don't close down. There's lawsuits that take care of that. It's never been that the businesses have to be responsible to the community. So it's like, I think there's going to be things going on, and people are going to try to be ignorant of it or try to just not tell anyone for their own benefit and their own gain.
Let me read some comments. My doctor said the worst hasn't happened in our state yet, and opening things up is not good at all. Lee, you are not alone. Take a look at these experts from the University of Arizona. They're saying the exact same thing. You're hearing this kind of concern that the governor, in this case, Governor Ducey, and his stay-at-home orders were working against COVID, and that rushing to reopen will cause people to get sick and die. It's dangerous. It's not a good thing. Sherry comments that she agrees with the doctor's perspective. From her perspective in Texas, it seems that the numbers keep growing. It's going to get worse here with opening of restaurants, movie theaters, and malls. They're opening at 25% capacity, I should add. Wow. And that's at 25% capacity. Can you imagine if it was 50%?
Yeah.
That's so scary. Lee comments that her hub is still working and gets everything. And she wants to know if these meat plants with the employees when the employees get this virus, is it transferred to the meat that is packed for us to eat? That's a great question. I believe that I'm going to have to get back to you on how or whether the meat can have the coronavirus on it. I mean, if it can stay on surfaces, one would imagine it can stay on the meat. How long? And whether the food that we eat that could be contaminated with this would get into our respiratory system or transferred through another way that I don't know about. I don't know. We'll have to look into that further for you, Lee. Sherry comments also that she's been doing a lot of phone calls with her doctors, and she is high risk. Her husband is too, and their grocery stores do home deliveries for seniors, but it's been hard. But he has been out for gardening stuff. So a lot of people are trying to grow their food. And of course, we keep learning new things every day. Like we learned yesterday that dogs can get it now.
Yeah.
They told us dogs couldn't get it. Now they're saying dogs can get it. Folks, the reality is that we continue to see outbreaks happen, and now that we're reopening, governments like the one in Georgia that they said was the least prepared to open in the whole country. And guess what? The majority of the people that are going to get sick, that are going to be hospitalized, and they're going to die have been trending toward the darker colors. Here we see in Georgia that as Georgia is reopening, a new study has found that more than 80% of the people that are hospitalized, COVID patients, are Black. So African Americans are showing us the racial disparities of this virus. Latinos, who disproportionately work, as well as immigrants, who disproportionately work at these very crowded meatpacking plants, are the ones that are going to be on the front lines of getting these diseases, especially if they are not changed so that they're more safe. Meanwhile, guess what, Duke?
What?
They have released a commemorative COVID coin. I don't know how poor taste this is in, but apparently this was an Ivanka idea, they're saying.
Oh, my God.
This is from Raw Story, so I don't know how much I trust that it was Ivanka's idea, but it appears this is true because I checked on the White House gift shop. You can now purchase for $100 the COVID-19 Task Force commemorative coin. It's got a coronavirus on it.
Yeah, and it says, together we fought the unseen enemy. Everyday heroes suited up. Everyday citizens did their part. It's like like they're saying it's over,
Hey, Mother's Day, Father's Day, just around the corner.
Yeah.
You know, for the mom and dad that have everything, I doubt they have a coronavirus coin. So there you go. You're welcome. I solved your shopping problem. Here is some news about what is going on in Wuhan, the true numbers. Because as we have said, we don't trust the numbers coming out of China. U.S. intelligence officials believe that the true scale of China's coronavirus outbreak is at least 50 times worse than the communist state is admitting to, and that 60,000 dead bodies a month have been processed through their funeral homes and their incinerating bodies every day, 24/7. Well, we had been seeing, because they have satellite imaging that shows all of their different crematoriums working around the clock, people lined up out down the street waiting with urns, waiting to pick up urns. And this was a daily thing that was going on. So people were like, how is that possible? How is it even possible that they're saying they have no new cases, no new deaths? I don't know how you can trust that.
Yeah.
So now we know it's not true. What else are they not telling us about recovery? What else are they not telling us about testing? What else are they not telling us about treatments and vaccines? Fortunately, folks, there is a remedy. Oh my God, I don't know if I'm going to be able to say it. Remdesivir. That's it. I feel like my Spanish students when they're trying to pronounce something. Remdesivir has now, the data I told you that was going to come out in May came out a couple of days early.
Okay.
Look. Now, this is by far not a completely, it's not tested out completely. This is the first testing that is coming out that they can publish and share with people. And this is only pertaining to some 300 cases. We'll share the link with everyone. This data from the Science Inc. company named Gilead raises hope in this pandemic fight. Dr. Fauci is calling it highly significant. The top U.S. infectious disease officials have said that Gilead Sciences Inc. experimental antiviral drug remdesivir will become the standard of care now. And Dr. Fauci has confirmed that remdesivir is showing positive, significant effect in stopping the virus, which is very good news. Look, folks, it is a 31% faster recovery than when you get placebo. Is that great? It's significantly higher. It's not 100% of the time, but when you're talking about people recovering from being in the hospital, and by the way, this has to be applied early on. This is the most important part of the study that I noticed. So, when people are treated with this, when they have mild symptoms at the beginning stages of the illness, they have an outcome where 60% of them, when treated with remdesivir, get better and don't have to be hospitalized. That's pretty high.
Yeah.
But you have to catch it early. Gilead earlier this month said the company was prepared to donate to hospitals its existing supply of 1.5 million doses of remdesivir, enough for more than 140,000 patients, depending upon their length of treatment. They're recommending a course of treatment at this time of 5 days. This is what I'm hearing. I think there is mixed results on keeping someone on remdesivir for longer than that. The National Institute of Allergy and Infectious Diseases, part of the National Institute of Health, said Partial results from its 1,063 patient trial shows that hospitalized COVID-19 patients given remdesivir recovered in 11 days compared to 15 days for patients that were given a placebo. I know that those numbers sound very small, and that's why I am not able to interpret this data with the kind of confidence that someone like Dr. Fauci can, because they're the doctors, they're the scientists, and they know this is a significant changer in the COVID fight for us here in the United States. A lot of people are criticizing Dr. Fauci coming out and being so happy about this, as opposed to the way that he treated the news about the trials on hydrochloroquine, because this medicine is considerably more expensive than hydrochloroquine. But despite what people are the naysayers are saying, just looking at the science, the new data offers a glimmer of hope that remdesivir has an effect against COVID-19, but more scientific analysis is still needed, comparing them to other studies of the drug that have shown mixed results. Also on Wednesday, results were published by the Lancet Medical Journal of a trial conducted in China that concluded remdesivir failed to improve patients' conditions or to reduce the pathogen's presence in the bloodstream. Gilead said previously that those findings were inconclusive because the study was terminated early. You may recall that coming out earlier this month. The drug seems to have antiviral activity, yet how much is unclear. Dr. Daniel McQuillan, an infectious disease specialist at Leahy Hospital and Medical Center in Burlington, Massachusetts, told Reuters it seems likely that it might need use with another antiviral agent. Combination antiviral treatments have proven highly effective against other diseases. Gilead also provided data on a study in severe COVID-19 patients, and it's conducted in dozens of medical centers, which does not have a placebo comparison, but tested the drug under 5-day and 10-day regimens. Anyway, in that 397 patient trial, Gilead said 62% of their patients treated early with remdesivir were discharged from the hospital, compared with 49% of patients who were treated later in the course of their infection. Gilead Chief Medical Officer Madrad Parsi, in a statement, said a 5-day regimen could significantly expand the number of patients who could be treated with our current supply of remdesivir. It's not enough, I know, but it is a glimmer of hope, and there's more. Guess what? The UK is now coming up, Oxford specifically, has come up with possibly they will have a vaccine ready by September. How is that possible, Cindy? You've been telling us it takes 18 months. Nobody can come up with a vaccine faster than that. Well, guess what? It just so happens that the Oxford people already had a SARS-CoV vaccine that they were working on that was in advanced stages, and now they're using it for this. Take a listen.
The first volunteers now getting their dose of a vaccine that could protect the world from COVID-19.
It seems like the right thing to do to ensure that we can combat this disease and get over it a lot faster.
The team at Oxford's Jenner Institute are fast-tracking their trials because they've already tested a similar vaccine for another coronavirus, Middle Eastern Respiratory Syndrome, or MERS. They believe it's safe. The big question is, does it work against this new virus too? This morning, an encouraging sign from researchers in the U.S. Scientists at the National Institutes of Health's Rocky Mountain Lab in Montana gave the vaccine to 6 rhesus monkeys, then exposed them to large amounts of COVID-19. 28 days later, none of the monkeys had the virus. The lead researcher telling the New York Times, the rhesus macaque is pretty much the closest thing we have to humans, but that scientists are still analyzing the results. The Oxford team thinks they'll know whether it works in humans by July.
And that gives us confidence that, firstly, this is going to be safe when we use it for this viral infection. We have a good idea of what type of immunity it produces.
The team is already working with manufacturers around the world, including Millipore-Sigma in Massachusetts, an arm of German pharmaceutical giant Merck, to speed up mass production if the vaccine works. 1 million doses are already being produced at risk. That means if the vaccine doesn't work, the doses will be useless. But if it does, they'll have a big head start, delivering a desperately needed vaccine as early as September and taking on the next challenge.
We are aiming to make not millions, probably not tens of millions, but ideally hundreds of millions of doses of this vaccine, because we really believe that is what will be required, even in the second half of this year, to help put out this pandemic.
To help put out this pandemic, if they could ramp up to creating vaccines, hundreds of millions of them, if it turns out, and it's looking promising, that this vaccine will work against the coronavirus, then there is a light at the end of the tunnel, and it's not a train. And all of the things that we have been wishing for and praying for so that we can go back to normal, so that our economies can move forward, so that we don't crash, so that we can go back to having some semblance of normalcy in our lives, could be just around the corner, folks. We just have to hunker down, be patient, keep social distancing, wash your hands, wear your masks. Don't let down your guard. Don't let down your guard now. Even if your states aren't doing, even if your businesses aren't doing what you think is the safest thing, you can do it. Make sure that you're the force for good in your community, in your town, and be patient because help is on the way. I want to leave you with a funny little video. Why don't you tell us what we're seeing here?
Oh, well.
Narrate.
Yeah, funny. It's about face masks. You know,
And going into businesses?
going into businesses with face masks.
Okay, here we go.
Real.
Is this what we can expect to see in the near future?
Yes.
7-Eleven.
So the other day I went to 7-Eleven and they required a face mask to go in. And I put a
God.
pot lid on my face and surprisingly they let me in.
Oh, God.
So decided to try something else.
What? A watermelon.
If this works, I'm gonna cry. Hey, let's see what's up. What's up, brother? Coronavirus.
I don't think that's effective for a mask.
Yeah.
But you know what?
A shield, maybe.
Oh my gosh. Okay. I suggest that you use the masks that are made out of cloth and that have, there's some now with filters. Look online. There's a bunch of different fabrics. I believe one of them that really actually works because it creates that electromagnetic static that keeps smaller particles out.
Yep.
Chiffon from dresses. It's worth looking at all of the different types of masks that are available that can give you some added layer of protection. Make sure that you wear them. Make sure the people around you in the businesses you want to patronize are wearing them. Hit us up. Tell us how the local economy is doing. Tell us how local businesses are keeping you safe here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. God bless and good night.